I was randomly placed on a pretty amazing project sponsored by NASA. And really what it taught me was how transformational technology can be and how futuristic it could be. And if we could do it in the whole aerospace and NASA, we could definitely do it in the dentistry.
Welcome to another episode of the 3 on 6 podcast with Dr. Randy Roberts.
Education, empowerment, starting now.
Welcome to the 3 on 6 podcast with Dr. Randy Roberts. Today I am really excited to announce our special guest, Dr. Amir Mansouri, who is the CEO and founder of SprintRay. And the reason I'm excited is because as a dental professional, it's really a marriage between me being able to do my surgeries and doing it with, all I can do is put things into people's mouth, and those things have to be created by someone else. And this guy here has created he's revolutionized the dental industry. He's one of the top most influential people in dentistry, as recognized by the industry. And for me, in my practice, he has helped save thousands of dollars and so much time and effort because of the materials that he has made. Some of the problems that I had initially with doing the 3 on 6 were trying to find immediate materials that were strong enough and hygienic enough to get good results for the 3 months while we were waiting for our final restorations to be made. Because a big part of the 3 on 6 is developing healthy tissue for 3 months after the surgery. And so going through different materials, if patients would chew too hard on food or something like that, then the restorations would break. If the restorations break, that means that the implants are more likely to fail and have complications. So his company has continually made everything better and faster. When we do a surgery, the patient is asleep waiting to wake up, and so there's just precious time while we're waiting for these teeth to be made. He's not only making the best materials, but he's making the best materials the most beautiful and the fastest. And so it's like I've just been amazed at this company's ability to make my life so much better and easier, which is why I wanted to bring him here to Cabo with us and to have him present to our doctors, because just what he's been able to accomplish in just 10 years since he started this company has just been amazing and transformative to the dental industry and to me personally and to so many of our wonderful patients. So thank you so much for being here and for doing this interview with me.
My pleasure. Glad to be here. Beautiful weather in Cabo.
Yeah, thank you. So can you tell us a little bit, like, what has your journey been from, you're just telling me you actually moved here. Just tell me what has your journey been?
Absolutely, yeah. The whole 3D printing journey for me was during my PhD at the University of Southern California, USC, right? Onto all the Trojans watching this. And I was randomly placed on a pretty amazing project sponsored by NASA. Wow. To be able to 3D print on the surface of Moon and Mars eventually. Construction structures, really. The idea was to send a robot, use the material that is available on the surface of Moon, and 3D print landing platforms, fuel vessels, and that was my PhD life in 2012, 2013. And really what it taught me was how transformational technology can be and how futuristic it could be, and if we could do it in the whole aerospace and NASA, we could definitely do it in the dentistry.
Yeah. So how did you get into dentistry?
Yeah. So dentistry was I think sometimes I say dentistry found us. We were not in the dentistry in the first 2 years of the company. We were really trying different industries and see what we have to do. At the beginning, we just had a high resolution 3D printer. And you mentioned materials. We did not even have a single line of material. We were just a hardware and a software company, just like anyone else. And the first 2 years of our journey, we were looking for a solution for a problem to solve it with the solution that we had. Our solution we had was a high resolution 3D printer. And Glidewell in 2016 bought one of our desktop high-resolution 3D printer. I had no idea who Glidewell was, and I had no idea what dentistry was. I mean, I'm not a dentist, I'm an engineer, and no one in my family is dentist. So my only encounter with dentistry was just going to dentists for regular checkups and any dental work. So the first time I stepped foot on a dental lab was at Glidewell, and I was blown away by how much they have advanced system. So they were going to use the 3D printers to replace their old school industrial printers with a printer that is more tabletop, more versatility, and that was exactly what we're doing. So we worked with them for about 6 months to a year to fine tune some of our software. They wanted some different materials, we didn't have access. And really, it was 2017 that we saw a big gap in dentistry that could be filled with chairside 3D printing. When you look at 3D printing, it's amazing for mass customization. Let me ask you this. Name an industry that does mass customization more than dentistry.
Yeah.
It doesn't exist.
Yeah.
Anything, your jacket now, your hat, your watch, these are all batch produced.
Right.
They barely customize. You customize your white coat.
Right.
That's the degree of customization. When it comes to dentistry, every single part that you guys are producing in the mouth is customized, and you want a lot of them. Then on the other hand, when you look at 3D printing, it's not good for batch production and mass production. It's perfect for mass customization. It really made total sense to put one of these powerful machines at the point of care and enable the doctors, the clinicians, the dental staff with software solutions, hardware solutions, and material solutions to print what they needed on demand, on the spot.
So you started off with Glidewell, and you thought, I should get this to the dentist instead of just to the lab.
Correct.
So this was your thought process, and you're just like,
It was more like you follow the path of least resistance,
Yeah.
as well as, entrepreneurship. You try what works, and when it works, you kind of double down on it. First, we were not in dentistry, then we found dental lab. Then we tried dental lab, and they were only printing dental models, removable dies to test the fit of a crown before shipping it to doctor. We're like, this is boring.
Yeah.
This is boring, printers are more capable. What if the crown can be printed chairside? What if this night guard can be printed? What if the surgical guide that you guys send it to lab, wait weeks for the parts to get ready? I think that was the kind of thought process. And then we tested it by, the first time in 2017, we came up with the surgical guide material, and clinicians, super early adopters, started to buy it. And that was my first really sign that this is working. Then talk to them more. What else do you need? Can you make a night guard material? Yes. Develop the night guard material. Can you do a temporary material? This whole crown is started by a temp to final to long term. And more, I think the past 8 years, my life has been hanging out with a lot of cool doctors, a lot of geek dentists who all we talk about is material science and designs and how we can solve some clinical problem and prosthesis problem with that. And it was a game of doing it more. And after a while, it become fun, it become your passion, and we keep doing it. It was just progression of a journey.
so it sounds like the progression is relationships like this, where you're just hanging out with doctors and they said, I like this, but could it be stronger, or could it be prettier? Or it's like, so just constantly having these conversations, because you're not a dentist putting these in people's mouths, but
True.
you're mostly just having to get all the feedback from the doctors, or how does that
All the time, like you were telling me the first 3 months is on Onyx, then you switch to zirconia as we were walking the steps. I'm like, okay, what can I do? What should I do for this guy?
Right.
That the final is also Onyx. And then the next thing is, what do you need? What if I add some better wear resistance? What if I add some antimicrobial properties to that? You want it stronger, what if I make it stronger?
Well, with your new Midas printer, like, I wonder if I'm not going to be able to start being able to do my finals with that.
Right. So Midas is a platform that really enable us and a lot of other material companies to put materials that they could not be printed before. And
Right.
really the innovation of Midas is the ability to print viscous materials. And yes, we're so excited because now the new generation of materials that are 70%, 75% filled can be pressed in the form of a bridge or a full arch using Midas. Give you an example, Onyx is only 35% filled.
Yeah.
And imagine what we could do for the Onyx 3 on Midas, what other particles we can do. I'm super excited about antibacterial properties, those nanoparticles, but the moment you add it to the resin, they become so thick, impossible to print on normal regular 3D printers.
Yeah.
That's it, that's the next generation. Can we put more antibacterial properties on top of or add it to the mix to be able to press those?
So the Midas seems totally revolutionary, right? It seems like you're able to say, okay, we've gotten to our limit with what we can 3D print, and we need to now start a new limit. We need to be able to get thicker, more viscous materials, to get stronger ceramics in there, and we need to start 3D printing those. It seems like you're able to, see the market and see what's needed, and you're able to just come up with solutions in somewhere where that's like 40 years, like you said, 40 years of the same. You're like, this needs to change, and you're able to do this over and over again. Like it seems like you're able to just disrupt this whole industry, and you're kind of like the arrowhead in the 3D printing dental world of just pushing everything forward.
That's exactly what happened. So when we go back to 2017, we started dentistry. It was only models. Then we brought surgical guide. Then we brought night guards. And everyone when we started doing night guards, everyone was saying, no, it doesn't work, it break, they're not durable. And we proved everyone wrong. And those risks, small or big, really made us believe that 3D printing restorations and prostheses for long term is doable, is possible. 2021 and 2022 is the years that we really shifted the entire R&D to do more prostheses, to be able to do prints, materials that could be used in the mouth as a prosthesis long term. In 2023, we launched ceramic crown on top of our crown kit. That was essentially a kit on top of our regular Pro 1 printer, and it was 50% filled. Once we did that and we saw the traction in the industry, because everyone was said, well, these materials are composite, they're not gonna get traction. We saw people are using it. The data is good. 2 years where it's good, it's performing, there's no debound. They're really performing in the mouth. Really made us believe that, okay, we have a path to prove these materials can be used long-term, either for single unit or multi-unit. So that was one path of the progression of SprintRay. The other path was, as you said, we hit a theoretical limit of what can be printed using existing technologies. Existing 3D printing technologies that every other company has is a 40-year technology. Chuck Hall 3D System founders in California invented it, and everyone did some incremental innovation on top of it. And the other part of the whole equation is no other company was looking at this problem as a hardware, software, and material problem. There were material companies that were trying to fit whatever they had on the existing platforms, and there were 3D printing companies that were trying to really do the same thing, to optimize their hardware to work on existing materials. So SprintRay is the only company that is focused on hardware, software, and material all together. And once we essentially put all of our R&D together, guys, we need to press this material, we need to print this material. Press was invented after. That should be more viscous. Look at it, that's how this material is. Then the hardware guys came in, the R&D engineers came in and said, I can't do it on the existing platform. What if we change the whole architecture of the printer to be able to press these? And that's how Midas was born. In 2023, when we launched our crown kit, Midas did not exist on our roadmap. I just want to tell you how fast we sprinted.
Wow. It sounds like you guys have an incredible culture of like creativity and friends, and like it seems like you're a pretty big company, and it seems like when companies start getting to a certain point, there's a lot of people that say, no, we can't do that, and it's like it's really slow to get progress. But it feels like you guys are progressing at the speed of people having good ideas. You're like, okay, we're going to incorporate that, let's do it, and you're able to figure these things out and make it all happen. Like how do you create this culture and this company where it's like, we're not just a hardware company. We also create materials. We also create software, and you're creating it all uniformly so quickly and so beautifully that you're leading the industry. Like, how do you do all of that at the same time?
That's a very good point, Randy. I think we're 10-year-old at this point. It's a decade. It feels like yesterday that we started. But we were able to keep our culture. I think two things. One is all of our 4 founders are still in the business.
Yeah.
It's very rare. People, partners break up, partners start leaving each other. It's been 10 years that all of us stuck together, and all of the founders are running the company. So the same passion that we had day one, the passion to make better things, the passion to solve problems, the passion to innovate, still exists among all of us. My CTO is my co-founder, my head of product is my co-founder, I'm running the company, and the guy who is in charge of our manufacturing is the co-founder. So 4 of us still around.
So how did you guys find each other? How did you come up with this group of 4 amazing humans?
It's sometimes universe planet, sometimes you get lucky. The CTO was a PhD lab mate of mine, and then we were just all enamored of doing something together. And then the other co-founder, head of materials, I met this guy in Malaysia in 2007. 2007, I was for a material master's in material science degree. I was doing it in Malaysia. That's a different story. Why in Malaysia? And that guy I met him was an industrial designer, super talented. Then about 7-8 years later, I saw him in LA, and that's how it happened. I started to do that together. And I think that's one, founders are still around. The second thing is...
So did you find all these founders? Like, you just were randomly picking them up and like, you, and...
So Jing, my CTO, was my lab mates. So we started. Then the next guy I called was this industrial designer, Haas. He's the head of products. And head of manufacturing, it was a buddy of my CTO.
Yeah.
Really, we came together. And the first 2 years, we barely had a company. You didn't even know that you're going to be in business the next year or the next day.
Right.
So we tried it and it worked, and we tried it and it worked, and failed and it worked. And after a while, it became so much fun, and we turned it into our passion that we stuck around. Well, back to your question of how do we keep the culture? Every single day, I wake up, it's the fight for relevance. It's the fight for relevance to you and other colleagues of you to choose us, not because we're cool, because we have a technology that is better than others and we can solve problems that no one else can. And I think we're really founders driven, not really driven by quarterly results and a lot of short-term objectives. And that fight for relevance really made us do things that are so risky and also so revolutionary. Other normal companies that are run by post-founders, maybe they're worried of get fired. People get fired for making a bad decision in, normal companies that are run by a professional management. We're not. We're founders driven. We don't care if we fail, we go try it out. Midas was the biggest risk in the SprintRay history because we were launching a brand new technology, brand new way of doing things in a way that is not done before, and cannibalizing our existing 3D printing line that it works and good. In normal corporate America, in normal Wall Street driven environment, they don't do it because it's too much risk. But we don't care. We just do it because we have to.
Yeah. Well, that's an incredible company that you've created, and it seems like an incredible journey. And I love all of your products.
Appreciate it.
We've been using SprintRay for several years now, and like I was saying in our meeting a minute ago, like I have a cemetery of 3D printers because I've bought all of them and tried them all out, and they've all been good. Yours have just been better, stronger. Like I just presented in my presentations with your materials, your Onyx stuff too, which I absolutely love. It's so strong, it's so beautiful, and the tissue actually attaches to it. So so if you polish that material and you put it in there over the course of the 3 months, I could take out all of the screws, and then I try to pull the teeth out and they're stuck still.
Really?
Because it's actually attached to the tissue, and I have to rip it off. And so you can see where the tissue is actually attached to that material. So it's so biocompatible that your tissue loves it and will attach to it. And so it's just this perfect, in my mind, perfect material for what we're doing right now because of all of these properties. Beautiful, able to print so fast, able to attach to your tissue. But yeah, so thank you so much for all that you've done for me, for the whole dental industry, for the dental community. I don't know how much love and praise you get from the dental community. I suppose you can see that your products are selling all over the place, and that's awesome. But and now you're at Harvard on their what was the
Innovation Advisory Board.
and so yeah, it seems like you are getting a lot of love from a lot of places.
Absolutely.
People recognizing your talent in our industry, so that's awesome.
Appreciate it. Yeah, the community, I think, keep us honest, and we never take it for granted, the position we have. And again, you're happy with Onyx 2. We're already working on Onyx 3 and Onyx 4. Your normal business decision in corporate America is, okay, that's good, milk it. Squeeze whatever profit you can out of it. We're not doing that. We're really going for the next generation. And every product line is a big risk because that product is already working. You could potentially jeopardize a successful product by bringing a new product.
Right.
We're not doing it. We're not taking our position for granted. Again, we stay humble and keep working with the community to grow and improve.
Yeah, it's a big risk of investment, but you also have an amazing R&D department where you're trying all of these things out and making sure that before you deliver it to us, just like you said, you're working on Onyx 3 and you're working on Onyx 4. It's like you have these years of research and development, trial, and making sure that it actually is the best thing before you deliver it to us. And I definitely really appreciate that. Of course, I would like to have some of these things sooner, but we also want to make sure that it's...
We can solve that problem. We can get you some stuff before the market to test it out.
That would be awesome.
I would love to have the 3-on-6 community and the SprintRay platform beta testing and early testing.
Yeah, we'd love to be doing that.
Awesome.
So yeah, thank you so much for coming on. Is there anything else you want to say about SprintRay, about your company?
No, I just wanted to give a shout out to you and 3-on-6 community for really, again, you guys, exactly what you guys are doing is what we're doing too, pushing the boundaries. Why? And just saying why and why and why. Why full arch? Why this has to be chopped the bone? As a experience of a patient, I mentioned that my dad needs a full arch. I haven't done it because I truly cannot see him going through that process of chopping the bone off. And really what you invented as a 3-on-6 is better for the patients, better for the clinicians. The progressive loading really avoid a lot of bone loss long term is for the patients. So shout out for you for inventing it, but also pushing it. It's not easy setting up events, coming on here, a lot of coordination, a lot of people to please. It's not easy, man. So congrats to you and kudos. I know it's a lot of hard work. Keep it up.
Thank you. Yeah, and similar to you, I have a team of amazing people that are, my partners are largely my brothers. I've got brothers that are amazing partners. So that for me, that's how I found my partners. It's like, I grew up with them. I'm the youngest of 8 kids. So like my CEO is my brother John, who's been my best friend since I was little. The guy that runs my lab is my brother Brett, who I've always known. He's been like really mechanically and engineered minded, and he's a great artist and he's really smart. So being able to have those people in my family, I feel like that's a little bit easier, less of a risk for people that you know that you love and you love working with and you know they're really smart. So how you built your company with, I'm like, that seems a little bit more scary, a little bit like, do you know you're going to be friends in 10 years still? And just make it.
You got to take risks, but overall, nothing is easy. Even with family members, it's harder. Even a lot of emotions are involved between family members.
It can be hard sometimes.
The relationships are more professional in a non-family member. In family, it's different. So kudos to you and the brothers. 8 kids. That's amazing, man.
Yeah. So yep, I'm the youngest of 8, and 6 boys, 2 girls, and I personally have 6 children. And how about you? You have a wife, kids?
1 wife. Sure. No kids, so I'm working on it.
Okay.
Absolutely.
Awesome.
Yeah.
All right. Well, thank you so much.
Really good. Thank you so much. Pleasure.
If you're a doctor looking into 3D printing, for me, for the FP1, we have to have the strongest materials they need to be aesthetic, they need to be biocompatible. We want things that are actually attaching to the tissue. And I highly recommend the SprintRay because their printers are amazing. They're highly accurate. Their materials are the best. They're the strongest, they print the quickest, and they look the best. They attach to your tissues. There's not, and they're still innovating and coming out with even better things than what they've got, which is just crazy to me that is possible. But that's the type of company these guys are. They're constantly making my life and your lives better. So thank you again.
Appreciate it. Thank you, Randy, for having me in the podcast.
All right, you're sure welcome.
If you're considering restorative dentistry with dental implants, you should know all of your options. Head to 3on6.com and book a free consultation with a 3on6 provider near you. If you enjoyed this content, please like, subscribe, share, or leave a review in the comments. Until next time, keep smiling.